I'm a hip surgeon. I love doing hip surgery, and I've been doing it for a long time. It's a wonderful operation that relieves pain and restores function like nothing else. So what happens if you don't have surgery for your painful arthritic hip? This might be the case if you're stuck on a waiting list or just not that sure that you want to do it. After all, it is major surgery and there's always a risk of complications, some of which can be life-threatening. When you come to see a hip surgeon like me, we talk about your symptoms and how they affect your life. I ask you what sort of things you want to be able to do after surgery, like going back to work, playing sports, or just getting on with your life again. I ask you about any medical problems that you might have. We sometimes need to investigate these further if you're going to have surgery. This will of course delay your operation, and very occasionally we might agree that the risks to you outweigh the benefits of surgery. That doesn't happen very often, to be honest. But back to the question then of what happens if you don't have surgery. I find it helpful to think about this in terms of the impact on both your general health and then the effect on the bones and muscles around your hip joint. A painful hip makes it difficult to take exercise, and you can quickly become unfit. We call this becoming deconditioned. The risk of having a stroke or a heart attack might be increased, particularly if you already got some risk factors for these, such as high blood pressure, diabetes, or you're overweight. Balance can be affected, and this increases the risk of falling. Taking painkillers and anti-inflammatories for months or even years can increase the risk of health problems like ulcers and kidney damage. If your hip pain wakes you up a lot at night, this can make you feel exhausted and even lead to depression. Bones need to stay stressed to stay strong and healthy. If they aren't, then you might be at risk of getting thinning of the bones or osteoporosis. Muscles get weak and the vicious circle just keeps going around and round. All of these things taken together increase the risk of frailty. I talked about this in a video a few months ago, and I'll put a link to it below. When I see you in clinic, we spend a lot of time talking about the risks and the benefits of surgery. After all, it's your hip, and you need to know exactly what you're letting yourself in for. I have a duty to tell you not only what to expect from surgery, but also what to expect if you don't have it. It's not always a straightforward decision, and you need time to think about it. I've seen many patients over the years who decide to walk away and put up with their symptoms, only to come back a few months or even years later, having decided to go ahead with the surgery. One of the many miraculous things about the human body is its ability to repair and to regenerate. Even if you aren't at the peak of fitness when you have surgery, within a few weeks you'll be well on the road to recovery. If you'd like to know more about anything to do with hip surgery, then please get in touch. The details are below in the description. Thanks for watching. See you all again next time.